Mental health impacts all aspects of work, whether you work on a line in a manufacturing facility or you are a lawyer or a doctor. So all aspects of mental health really impact all aspects of work. Employees are looking for employers and leaders to address mental health and not just assume it's something you can leave out of the workplace, because it's not anymore.
Welcome to Hope Starts With Us, a podcast by NAMI, the National Alliance on Mental Illness. My name is Daniel H. Gillison Jr. I am the CEO of NAMI and your host for this podcast. So we started this podcast because we believe that hope starts with us, all of us. Hope starts with us talking about mental health. Hope starts with us making information accessible. Hope starts with us providing resources and practical advice. Hope starts with us sharing our stories. And hope starts with us breaking the stigma. If you or a loved one is struggling with a mental health condition and have been looking for hope, we made this podcast for you. Hope starts with all of us. Hope is a collective. We hope that each episode with each conversation brings you into that collective to know you are not alone. So today I'm joined by NAMI Chief Innovation Officer Darcy Gruttadaro to talk about workplace mental health. Darcy recently rejoined NAMI from the American Psychiatric Association Foundation, where she directed the Center for Workplace Mental Health and was recognized for her outstanding work with the APA Leadership Award. Prior to her role at the APA, Darcy spent about 17 years at NAMI in multiple senior level roles and also spent her early career practicing law around issues related to physical and mental health. Darcy, we are so pleased to have you back at NAMI as our Chief Innovation Officer. And we are excited to have you on this episode to share all of your expertise about this critically important topic of workplace mental health. As we think about it, that's where we all spend so much of our time, the workplace. So I just wanted to say thank you. Welcome back to NAMI, and we're so excited to have you at NAMI and to have you with us on this podcast today.
Thank you, Dan. It's absolutely a pleasure to be here. I'm very excited to be back at NAMI, and I'm excited to be working on innovation. I think NAMI's been such a tremendous leader in the mental health space for so long, and I just look forward to really exploring ways in which we can work across the workplace, across youth and young adults, across diverse communities, really across the entire alliance. NAMI has such a strong field with state and affiliate organizations, and I just feel really a great privilege being here working with you at the helm and with the leadership team. It's just a real pleasure. So thank you.
So Darcy, we're going to focus on workplace mental health. However, with the breadth, width, and depth of your experience and years in the mental health space, both with NAMI and with the American Psychiatric Association Foundation, you have almost 25 years of experience that you bring to this conversation. So whatever you'd like to share with our audience, we welcome you to do that, because this is where we want people to know they are not alone and that hope starts with us. So please, if you want to broaden this conversation, leading in with workplace and taking it further in your scope, you are welcome to do that. So let's start with workplace mental health. So as I frame it, let me just start by saying over the last few years, we have had a transformation in the way many view work-life balance and the relationship between work and well-being. With COVID-19 forcing people out of offices and resulting in the loss of so many loved ones, people have begun to see their work in a bigger perspective and prioritize their physical and mental health in new ways. Let me frame this a little bit. From athletes like Naomi Osaka and Simone Biles openly taking time off for their mental well-being, to the U.S. Surgeon General actually releasing a 30-page framework for workplace mental health. We have seen this topic become one of national importance with real implications, as many employees found themselves quitting their jobs or switching companies in search of workplaces more accommodating to their mental health in the last year during what many deemed the Great Resignation and the Great Reshuffle. We know that untreated mental health conditions cost the economy $200 billion in lost earnings each year through decreased work performance and productivity, and that 8 out of 10 workers with a mental health condition report that shame and stigma prevent them from seeking treatment. I think you taught me a word when early on, presenteeism. So yeah, and I know that'll be a part of this conversation. Recent surveys have also suggested that 76% of U.S. workers reported that at least one symptom of a mental health condition, and 81% reported that they will be looking for workplaces that support mental health in the future. Workers clearly care about their employers supporting their mental health, and employers clearly have good reason to be interested in supporting their employees' mental health. If for no other reason than because it can ultimately increase their company's bottom line. When employees are supported, they're more productive. Workplace mental health is good for everyone. So let's dive in. Darcy, your entire role at the APAF was directing their Center for Workplace Mental Health. And here at NAMI, you will be helping lead our workplace mental health and stigma-free company programs, among other innovative projects. What trends have you seen and seen shift over the last few years in workplace mental health? And what do you expect to see in the next coming years? And why is this such a critically important topic right now?
Yes, and it certainly is. I started at the American Psychiatric Association Foundation in 2017. And at that point in time, workplace mental health was already becoming a much more significant issue. And that's largely because employers were increasingly recognizing that mental health impacts all aspects of life, the way we think, we act, we feel, the way we look, our ability to interact with colleagues. It's just mental health impacts all aspects of work, whether you work on a line in a manufacturing facility or you are a lawyer or a doctor. So all aspects of mental health really impact all aspects of work. And there have been studies that have come out, as you cited, that really show how much our mental health and well-being impact the bottom line in productivity, in performance, in showing up, in bringing our full selves to work. And the more those studies were coming out, the more employers were recognizing the impact. And then in March of 2020, our world changed abruptly and dramatically with the onset of COVID. And what that meant was people were disrupted, first of all. And disruption is not something the human condition appreciates. We like certainty. We like predictability. We don't like sudden disruptions. That's very difficult for people. And so people had a chance to really evaluate their lives, their day-to-day lives, how they felt about the organization they were affiliated with, how they felt about the work they were doing. It was sort of a pause in life to really examine our priorities, our day-to-day experience. And that led to a lot of people really either feeling quite good about what they were doing or really questioning it. Hence the Great Resignation, the Great Reshuffling. But I would be remiss to not mention it was not just a global pandemic. At the same time, we were experiencing what I like to call the trifecta, which is global pandemic. We had political and racial tension at an all-time high in this country, with some very troubling racially involved incidents and injustices. And then we also had economic uncertainty. Again, that word uncertainty. People don't like uncertainty. So inflation, a recession, our economy really suffered with many small businesses closing as a result of the pandemic. So it was really this very disruptive time, a time when people could reflect, a time when workplaces were greatly impacted. And employers were, as I said, already really focused on mental health and well-being of their workforce, but suddenly it became much more of a factor. And the other thing I'll say quickly before I turn it back to you, Dan, is we all realized we all have mental health. Mental health was not over here or over there. We all experienced a change in our mental health as a result of that trifecta I just described. And so it was a wake-up call, and people started to feel more comfortable being open about the impact all of that was having on their lives.
You know, Darcy, this the trifecta and this fear, uncertainty, and doubt that was created with that trifecta that you mentioned is so compelling. And you also offered something about the fact that mental health impacts every aspect of our lives. So why would it be any different in the workplace? So thank you for kind of grounding us with that. I want to get into a couple of other items here, but I wanted to ask, what have you seen in terms of leadership and CEOs addressing workplace mental health, with them having seen the results of this uncertainty and this trifecta to their workforce? Have you seen any change in CEOs' attitudes, behaviors, and modeling in terms of their relationship with their workforce?
I would say, like anything, it's mixed. There certainly were CEOs and C-level executives who recognized we need to be more intentional about creating a caring culture. And those CEOs and leaders have seen great result because leaders set the culture in organizations, and leaders who have been successful at really creating that mentally healthy culture recognize that these are retention issues. These are recruitment issues. This is why people stay, that people feel good about coming into work. And feeling valued and feeling like what you're doing is meaningful toward the bottom line of any organization is really critical to the success of the organization. Because as you know, Dan, as the CEO of NAMI, employees are the greatest asset for most organizations because without them, the organization will not achieve anywhere near what they set out to achieve.
Yeah, thank you, Darcy. And you know, I'm gonna kind of invert this model a little bit with you, but we have this program initiative called Stigma-Free Workplace, and I think of myself in that C-suite, and I'm thinking about that label, Stigma-Free Workplace. What do you feel, and what does NAMI feel is meant by Stigma-Free Workplace?
I think it's a workplace in which people have information through an deliberate educational process to better understand mental health, that mental health is more normalized within the organization. So it's visible. It's visible on the intranet. It's visible in community conversations within the organization. There are lunch and learns. Mental health is regarded as highly as any other health issue within the organization. That's one. And then two, there are employee resource groups that are focused on mental health. There's a place for people to go to have conversations, and people feel psychologically safe to be open about the fact that they live with a condition and that they can live well with it. We know that people have mental health conditions right up to the C-suite level. And those organizations that are stigma-free have really made it a policy and practice to help people feel like it's okay to be open about a mental health condition. It doesn't mean there'll be questions around, is Darcy up to it? Can she handle this? Is she able to perform on the really key projects that we assign to her? There won't be those questions per se. There may be times, just like any other health condition, where people may need to say, I need a little bit of a break from this. I have diabetes. It's kind of flaring up right now, or I have another condition. Depression, anxiety, trauma, and other conditions are no different. People sometimes need a little bit of a break, or may need to sort of dial back slightly, but then really ramp right back up. So I think it's the psychological safety, and it's also a stigma-free workplace recognizes that it's as important that people have access to mental health care through the benefits plan, through the EAP, and through other options as it would be if they had asthma, if they had cancer, if they had any other health condition. So stigma-free means we're prioritizing access to care across the board, including mental health.
You know, there's this analysis that was done in 2018 that said that job stress nationwide may be costing as much as 187 billion, with 70 to 90% of those losses resulting from declines in productivity, and the pandemic has only worsened that situation. Do you have any thoughts about that? And how do you frame that in the workplace? I mean, that's tremendous amount of revenue.
Sure. And I think to pause a moment and just state the obvious, which is stress impacts our physical health. So we know the connection, it's not separate, it's very much connected. And people may have high blood pressure, they may have heart conditions, they may have other serious health issues as a result of stress. Having said that, a little bit of stress is not a bad thing. A little bit of stress helps us to really step up and really, play at the highest level, achieve at the highest level. But as soon as we cross that threshold of stress becoming quite excessive is when people are more at risk. They're at risk of mental health conditions. They are at risk of physical health conditions. They are at risk of shortening their lives, frankly. And this, again, can come down to leadership. So leaders who are very attuned to their employees and recognize that there may be times when they're excessive stress, but it can't be a constant. Those who are one-on-one checking in with people to ask, how are you doing? Again, checking in different ways. This is not like it was pre-2020. What we know now is that people are quite commonly experiencing stress, anxiety, symptoms of depression, symptoms of trauma, not necessarily from a diagnostic perspective, but people are just not feeling like themselves. So now more than ever, stress is probably at an even higher level than it was at the time of that study. So checking in and asking, first off, how are you doing? How are you really doing? You're sending the message, I care about you. You are a part of this organization. You're part of this community. Now, just to be clear, work is work, right? We all need to get our work done. We're paid to get a job done. But we are working in a different environment now. When you really show you care about your employees and you show it through the way you act and asking, how's your stress level? Or it's going to get stressful for a little bit, but then we're going to ease up. So just really sharing with them what the expectations are, trying to level it off so that stress is not a constant. It's not an everyday event. It does happen occasionally, but we're in this together. That kind of messaging from leadership can make all the difference, and really checking in to know, how stressed is my team? How stressed are my people? That's important too.
I want to come back to that word presenteeism. And presenteeism is this idea that someone can be physically present in the workplace. I could be present in the workplace, but not really there. I'm preoccupied with a family member. I'm preoccupied with my own mental health. I'm preoccupied with my stress is managing me versus me managing it. I'm not really productive, often because there's some kind of a stressful situation that's distracting me or any other employee from their ability to fully focus. Presenteeism costs employers money, and many employers have tried to address it through various types of quote-unquote wellness programs. In your opinion, what needs to be done to truly address presenteeism in the workplace? What steps do employers need to take to reduce burnout and best support the mental health and well-being of their employees, past and over the wellness programs?
Yes, I saw a great visual depiction of presenteeism, which was an office chair with clothes hung on it without a body there. And I think that is the best visual depiction of what presenteeism is. And so obviously that costs businesses money, and that's something that businesses want to avoid. And so it is really recognizing that also burnout, you mentioned burnout. Burnout is at really historic highs. So we know from research the ways in which we can combat burnout and really get at helping people to feel like they are part of an organization and are excited about the work they're doing there. And there's great research that's been done around 6 factors. So I'm just going to rattle those off because presenteeism and burnout and stress are all related. And that is to check in on workload. So there'll be, again, times, as I said, it's not a straight line on workload. We'll all have those busy times. But if you're not recognizing that workload is a problem when it's extraordinarily high all the time, you will have people who check out because they don't feel that sense of my organization cares about me. So they may not bring their full selves to work, or they may have something going on outside of work. But even in those cases, if someone feels comfortable in their workplace, they'll communicate that to their leader. They'll say, I need a little extra time. But if they don't feel safe doing that, they won't. So the second thing is really autonomy. People like to feel like they have control. Now, whether you work in a call center and someone's monitoring all the time, how much work you're getting done every minute of the day, to be able to give people a little bit of autonomy can go a long way. So giving them a little bit of choice, even in a day where they're highly monitored and highly regulated, is really important. Third is really creating the sense of community. Do people feel like they belong? Not simple to do in a remote environment. Even in a hybrid environment, it can be difficult, but creating groups, affinity groups, employee resource groups around topics people are interested in outside of the workplace. Maybe it's daycare for working parents and solutions around daycare, especially with pandemics, and we have RSV and we have the flu and we have all these health issues. For people to come together, even remotely, and share concerns, share ideas, again, that creates this sense of belonging and people feeling good about the workplace and therefore much more present in the work that they do. There's reward and recognition. It's simple, just not forgetting to say to people, thank you. Thank you for the good work you do, not from a platform of sharing, huge awards. This can just be a thank you one-on-one. I appreciate the work you do. Here's how it's contributing to the bottom line. It means a lot to us. And that goes to the fifth, which is really feeling valued and people feeling like the work I'm doing is important. I'm being told that, and I feel it in the way I'm treated here. So I'm going to be present and work my hardest because this is a place that cares about me and I care about them. And then the last is really doing meaningful work. Everybody wants to feel like they're contributing to something. At NAMI, we feel that way because we work on key issues in helping people live better lives. People can also feel that way if they work on a production line, if they make cars. It's all in how supervisors and leaders help people feel like what they're doing is contributing in a meaningful way to the good work of the organization.
You mentioned something about creating a sense of community, and then that word belonging. I just went to, NAMI just were invited to participate in a SHRM Foundation event for Chief Human Resource Officers. And for the first time, the thematic, their themes were three. They were culture, mental health, and belonging. And these chief human resource officers are across these United States global CHROs for the largest corporations in the country, in the world. And what was so interesting, it was the first time that we actually saw mental health and belonging as two of the themes of their work. Culture. You talked about the culture. You talked about leadership. And I'm so engaged in this conversation. And again, I have to say thank you. But you said check in on workload. You said autonomy, employees having choice. You talked about creating a sense of community. And it's that word belonging. And I want to go back to belonging because what we're starting to see is where organizations are starting to talk about diversity, equity, inclusion. They're including the B as a part of their programming and their language and their culture, belonging. And I want to come back to that in just a second. Reward and recognition. Sometimes the simplest acknowledgement goes the longest way. I just want to come back to that too. And another word you use, the sense of my organization cares about me. I want to come back to the words belonging and care, valued and meaningful work. So as a CEO, Darcy, and as our Chief Innovation Officer, but with your portfolio, as a leader, how does a leader toggle that world of being able to demonstrate they care, but still counting on that employee to be productive and to do the work? And in other words, managing it where one doesn't overtake the other. And we have some leaders that sometimes think that if they care too much, then the employee is not going to. So it's this calibration, because I think they work together, but I don't, it's almost like the elephant in the room that leader doesn't want to bring up. They don't know how to do them both and do them both simultaneously and do them well. There's this fear that if I do one, it's going to make the person think that they don't have to work. And if I do the other, it's going to stress them out and they're going to work too hard and they're not going to bring their full selves to work. How does a leader do both?
Yeah, I think it's a balancing act, as you've just described. It really is not all or the other. It's not one or the other, I should say. It's really recognizing that you have to balance it. It has to be authentic. So authenticity is very important because people can see right through something that is not authentic. And it is just recognizing that when you have one-on-ones or when you have meetings with people, it's it's often starting with the human side of, again, asking how people are doing. Sense of belonging is around people feeling like they know their colleagues well. So offering opportunities in a meeting to share a little bit about yourself, and not everyone's perfectly comfortable. You could share a little bit. Some people like to share more. I think as a leader, you have to use your good judgment to decide, where am I going to draw the line here? We do have to do a little bit of the human side. We have to do work too, but balancing it. And the other thing is employee surveys, asking people, and you can make it anonymous, or in many organizations do this. You can ask what people want, what they need. You can ask how you're doing in terms of some of those factors I mentioned. How are you doing on autonomy? How are you doing on workload? How are you doing on sense of belonging? Employees have great ideas. And it's always a good idea to not second guess what they might want, because during the pandemic, there were some surveys of employees done by PwC did some and asked what was most important to employees, because some organizations were delivering pizzas to people's homes. They were offering them, online yoga. And it turned out people wanted a little bit of extra time. Some wanted a little bit of extra time over a little bit of extra money. And so it's not second guessing, because asking employees what they want within reason. I think the more we communicate, this is a workplace. That's a leader's job. This is a workplace. We need to get our work done, but we don't have to be robotic. We're human beings. We're going through a very tough time. We're in it together, and helping people feel like we're in it together. We are a community, and speaking in those terms and asking people, how can we make our community stronger? What can we do as an organization to create that sense of belonging? And then when they come up with ideas, make sure you follow through on them, because that's where the authenticity comes in. And they may suggest something that's a little out there. And as a leader, you may feel like, okay, maybe we can meet them halfway. Just really using your good judgment as a leader.
What you just said is, don't assume as a leader, be open to asking. The power's in the question. So ask the employees what they think, because when you ask them and you get that feedback, you now know that, oh, I thought this, but now I know this. So that's wonderful. Thank you for sharing that. When there are conversations about workplace mental health, they're often viewed within the office and white collar settings. But what about in other workplaces? What responsibility do employers have to support workers' mental health, and what actions can employees take to protect their mental health in settings like fast food restaurants, retail, manual labor, agricultural work, construction, some of the other sectors?
Well, I certainly think mental health is as important, if not more important, because there are all kinds of socioeconomic dynamics that dictate whether mental health is a bigger issue in some communities, where there may be housing shortages, there may be food shortages, there may be all kinds of community issues that impact people's mental health. But mental health is just as important. Let's take construction, for example. Male-dominated, tends to be a stoic culture. It is exactly the kind of organizational culture in which being open about mental health, being stigma-free, is exceptionally important, because construction, some manufacturing, those are jobs in which there may be a stoic culture, and people may feel more like they have to suck it up, be tough, not show any form of quote unquote weakness, which unfortunately some people still associate with mental health. We know that not to be true. In fact, we've had many professional athletes at the height of their game come out and talk openly about their mental health conditions. So that's helping. But in some of those industries, they still value strength and toughness and sucking it up. So those are places in which it's even more important to bring in speakers, to have trainings for managers, to help leaders within those industries understand the importance of being open about mental health, to openly share information. I was attending a meeting in Texas, and I saw a group of construction workers out stretching very early in the morning. I was on an early morning run. They were all out stretching and loosening up their muscles with their hard hats sitting next to them on the ground. And I thought, wow, imagine if we had warming up on mental health before we started our workday on the construction site and just talked about, want you to know what some of the early warning signs are of mental health issues. Should you or someone you know experience it, let's talk about it. Because if we don't address it early, what we know is these conditions worsen, and they can impact anyone in any industry at any point in time in life. And so we want to make sure as an organization, we're supporting you on the construction site, within the retail setting, wherever it is, within the call center. And offering, maybe you're offering a little bit of mindfulness. Maybe you start the day with a little bit of meditation. I worked with a utility company in Canada who started their day with meditation. The pole climbers would lay down on yoga mats and have some quiet moments of meditation before they started their day in climbing poles. So this can be done, and the workers really liked it, and it was a male-dominated industry. So this can be done. I think it shows leadership commitment to mental health and well-being, and it's a great example that the workforce really enjoyed it and appreciated it.
Yeah, these models of success are so important, and I know that one of the things that we do so well is telling the stories, and I'm so appreciative of you sharing this information and these models of success, because that's what leaders need to see, it's so very important. I wanted to ask you, according to one recent survey, 84% of respondents said their workplace conditions had contributed to at least one mental health challenge. What does it mean to have a psychologically safe, positive, healthy workplace? And what can companies do to create this type of environment? And this may be a little redundant, Darcy, so my apologies, but I'd like you to dive a little bit more into that as you were speaking to it a little earlier.
Sure. Well, I think psychological safety can mean many things. So for some people, it means when they have a mental health condition, they feel comfortable letting their supervisor or manager know when they need a break or when they need to have an accommodation or they're having challenges in securing access to care. So it can be any number of those things. Not everyone feels comfortable being open about a mental health condition at work, and that's absolutely fine. But psychological safety can also mean that you feel comfortable bringing your whole self to work, that you don't have to, that you interact well with your colleagues, that if your colleagues know about mental health conditions, it's not something that they would ever make derogatory remarks about, or that they would ever talk about mental health in a derogatory way. I think psychological safety is also people having managers and supervisors who understand mental health conditions, have been trained in it, know how to have a conversation with someone they're concerned about who may experience a mental health condition. It's the way you interact with colleagues around any number of issues. It's making sure bullying is not a part of the workplace, whether it's manager to people who report to them or among colleagues. But it's having managers who are also empathetic and compassionate and understand mental health well and how to have conversations if they're concerned about someone. It is that caring culture that I mentioned earlier, too. But psychological safety is a very broad idea, and it really does come down to culture. And I also believe it's making sure mental health is highly visible. So we've seen mental health come out of the shadows and into the light, I would say, over the last 5 years or so, even more so since the pandemic, which is really exciting. But with that comes a certain sense of responsibility, especially for organizations, to be intentional and deliberate about mental health, to recognize that employees are looking for employers and leaders to address mental health and not just assume it's something you can leave out of the workplace, because it's not anymore.
I'm listening to you both for our audience and both for myself as a CEO. And as you talked about bring your whole self to work. And you talk about psychological safety. And you also talked about surveys, and you talked about employee resource groups. And I was thinking about some of the things that we did during the pandemic. We created an employee resource group for mothers and caregivers who were trying to navigate work, being now the educator for their child, and trying to be that family member all of a sudden with all these new stressors. We created that ERG group. We created the Rest Up Week to give our employees a time to step away. We also created Flex Days. So we're trying to model some of the things that you are our coach for, by the way. So thank you. As we wrap this up, I want to say the world can be a difficult place, and sometimes it can be hard to hold on to hope. That's why each week we dedicate the last couple of minutes of our podcast to a special section called Hold On to Hope. Darcy, can you tell us what helps you hold on to hope?
Well, I certainly feel very hopeful about mental health because it is so much more visible, but also hope is the recognition that tomorrow's another day. So even when today feels exceptionally hard, holding on to hope means I know the clouds will pass and the sun will come back out, because that happens over and over again in life. So it's recognizing that with time, and even a short amount of time, things can change for the better, and that we all have more people than we realize out there in our corner ready to cheer us on and to really provide us with support. And to me, that really gives me hope.
That's fantastic. Thank you, Darcy. What would you say to listeners who feel like giving up? How can someone feel hopeful when everything feels so hopeless? And what inspires you to keep going?
I would say, I'm going to take this from Ken Duckworth's book. I would say you are not alone. And sometimes people don't realize they're not alone until they reach out. So reach out for hope. Don't be afraid to do that. Many people who reach out for hope, who reach out for help, realize there are far more people out there ready to raise their hand and step in than they know. So reach out for help. People are out there. You are not alone. You don't have to go it alone. You have far more support than you realize.
It is hope and help, reaching out for hope, because we want you to be hopeful versus feeling helpless. So it is reaching out for hope and reaching out for help. And also, we want you to feel that your inner circle of friends and colleagues do care about you. And make sure you understand they care about you. And Darcy, I'm so glad you brought up the NAMI's book. You Are Not Alone, the NAMI Guide to Navigating Mental Health. There's so much good information there. And the information is not NAMI's information. It's the whole ecosystem of the mental health system, if you will, in terms of different resources, and with over 120 interviews from individuals who have lived that hopeful life and have accessed friends and resources, mental health resources, to actually navigate the space. So,
I wanted to jump in and say one more thing about hope.
Please.
When I was at NAMI before I returned, I worked with a young adult who shared with me that hope stands for Hold On, Pain Ends. And I just love that, because that really states what I was trying to just say succinctly, which is pain does end, and it ends because others are there for you. So just know that.
We want to, hold on to that right there. Hope means hold on, pain ends. That says it all. Hold on, pain ends. Believe that. This has been Hope Starts With Us, a podcast by NAMI, the National Alliance for Mental Illness. If you're looking for mental health resources, you are not alone. To connect with the NAMI HelpLine and find local resources, visit nami.org/help. Text HelpLine to 62640 or dial 800-950-NAMI 6264. Or if you are experiencing an immediate suicide, substance use, or mental health crisis, please call or text 988 to speak with a trained support specialist, or visit 988lifeline.org. We appreciate you. We want you to know this is about us caring. And we always say that people don't care how much you know until they know how much you care. And that's who we are, NAMI. We wish you the very best, and I hope you have a wonderful day. Darcy Gruttadaro, thank you so much for being our guest today.
My absolute pleasure.